A powerful display of the passion, dedication, and emotion that respiratory therapists and their patients share towards advancing respiratory patient care.
I never want to be defined by my illness, and so I do exactly that. I just live.
Anything that I can do to increase the quality of life for a patient, I'm all in.
The goal of the AARC Respiratory Patient Advocacy Summit is to improve patient care through advocacy, equipment, and services. This is achieved through lectures and discussions with respiratory care patients and advocates.
The patients wait an average of 121 minutes to go see their doctor, including 84 clinic minutes. So that means those are 84 minutes that the patient could be spending with a healthcare professional.
Patient and COPD activist Val Chang found a unique way to approach the current challenges to optimal care of the COPD patient. She broke it down to the top 3 challenges for COPD patients: education and care, medication and treatment, supplemental oxygen.
So we're going to help all of them so that they'll have better care.
Chang relied upon crowd participation as she walked through common issues patients face. Some of those things helping patients who smoke, vape, or those who don't understand medications.
So you help them sort out their medications, because a lot of them are on the wrong medicine or they don't use it right. I mean, they have done study after study where more than half of us are using our medicines non-optimally. In other words, we might be on the wrong one, or we might just not use it as well as we can.
A theme that Chang is an expert on: portable oxygen. She encourages all patients to find the right one to meet your needs.
When Valerie spoke about her condition and the things that we have to recognize when we see that patient and be ready to treat and support the patient as best we can as respiratory therapists. You know, our eyes aren't just focused on their treatment, but the whole patient, and how we can help them move toward a more productive life.
But it's not necessarily that we are treating the disease. We're not slowing it down. We're not stopping it. We're managing how it presents itself. It's that simple, which could be quite frustrating, not only for folks that are treating the disease on the medical field, but even for patients as well. Because we all want the cure. We all want to have some hope that it's going to get better.
Next to take the stage, patient Troy Fields. He says he's one of 30,000 Americans living with ALS, and he's living to the last breath. Fields first explained the uncertainties of the disease. Patients diagnosed are most often military vets or athletes, and most have no family history. There's also no cure.
For the most part, it's really this team approach that is kind of managing medication, the neurologist, the various therapists, respiratory, speech, occupational, physical therapies, etc. And they come together and they then manage your disease, manage a treatment plan, if you will.
Taking a deeper dive into the impact of respiratory care of an ALS patient, it's a 2-parter: ventilation and
clearing the airways. Because if it's obstructed, we don't have the strength to be able to make up for it.
Fields reminded the audience that tomorrow isn't promised. He encouraged us to make a decision to live.
Remember that life is not over the moment that you were given your diagnosis. Every morning that you wake up and you're above ground, that's a win. And so we then have a responsibility really to live that to the fullest. We've been given a gift on that day. And so it sounds so cliche, but until you're actually faced with that diagnosis, it becomes awfully real, awfully fast.
He reminded us there are a few things we can do to help. Be a part of a support group. Give a caretaker a break by either sitting with the patient or make an extra meal that you can bring over. And of course, donating to efforts to find a cure.
You've got the butterfly again representing the lungs. You've got the team of 3 figures. One is the patient, one is the family member, or any other part of the medical team, and the respiratory therapist. Together, you are helping the patient have better outcomes and to breathe easier.
Congratulations to the 2019 National Patient Advocacy Award winner. Registered respiratory therapist Kayleen Horn is active in making a difference in patients at a young age.
We get to go into the school, which is my favorite thing to do, and we have been putting on Asthma Blitz days. So we are assessing, educating, and doing medication checks with every child that has a diagnosis of asthma in Pitt County. So this year, we have seen over 1,100 kids in about 3 months, and we're just giving more education and more resources for families to have what they need at school to manage their asthma.
The day wrapped up with advocacy organizations discussing the challenges they're facing with patients and what you can be doing.
We love respiratory therapists in the Alpha One community. They have shown up, they help support us, they advocate for us, and they are a key to awareness because a lot of times the physicians may not be following the guidelines, which asks that all patients who have COPD be tested for Alpha One. And respiratory therapists can recognize these individuals and make sure that they get a simple blood test that can change the course of how their disease is treated so that they're treated properly.
The groups represented the ALS Association, the COPD Coalition, PH Aware Global Association, and the Alpha One Foundation. They took questions from the crowd, a chance for the patients and loved ones to get advice.
I think it's important that patients become part of what we do and see what we do. And a thing like this advocacy summit, I wish that more of my patients could have come because it was so important for them to see and to understand exactly what's going on in the field.
And I think that's important, not just to sit on the sideline, but to really take part in your own care. And doing that means doing a lot of different things other than just taking meds and oxygen and going through rehab.
Patients, loved ones, and clinicians should not miss this event in the future.
The communication between the respiratory therapist and the medical staff with the patient, that's just a huge, huge element in advocacy. Having someone that's behind you and that is advocating with and for you is so important.
I was actually surprised to find out that this was just so much about respiratory therapists advocating for patients, and I think that's great because as patients we're going through so much, and it's good to know that somebody has our back.
For more information on patient advocacy, legislation, and resources, visit aarc.org/advocacy or aarc.org/resources. For AARC TV, I'm Christina Jensen. Thanks for watching.